This is Group 176's presentation on Impetigo, spoken by Tim Hornby and Charlie Baker. Impetigo, also known as skin sores or school sores, is a highly contagious bacterial skin condition, which is especially prevalent in children. It is the third most common skin condition present in children after eczema and viral warts. In communities with less access to resources, Impetigo is a higher burden of disease and potentially affects an individual's health and well-being. Causes. Impetigo is a disease which is caused by a bacterial infection of the skin. Specific types of bacteria cause non-bullous and bullous impetigo. The main bacterium that infects the skin and causes non-bullous impetigo is Staphylococcus aureus. Streptococcus pyogenes is the other bacterium that can infect the skin and cause disease. A combination of Staphylococcus aureus and Streptococcus pyogenes can be isolated from the skin and cause non-bullous impetigo. However, this is rare. Staphylococcus aureus bacterium is always the cause of the bacterial skin infection resulting in bullous impetigo. Impetigo is a highly contagious disease spread easily through skin-to-skin contact. Symptoms. Unlike many other diseases, impetigo does not display systemic symptoms such as fever, malaise, and anorexia. A common symptom found in patients with impetigo is a draining of the lymph nodes of the infected area of skin. Two types of the disease exist, non-bullous and bullous impetigo, each showing differing symptoms. The symptoms of bullous impetigo are that the area of affected skin are covered in large bullae, blisters, that don't burst easily. The bullae can linger for several days. A decreased number of lesions compared to non-bullous impetigo and the trunk being increasingly affected by the infection are both symptoms of bullous impetigo. Non-bullous is the most common type of the disease, and the symptoms are characterized by initial lesions, which are thin-walled vesicles that rapidly rupture. A defining symptom is that the eruption leaves the wound with a yellowish-brown coloured crust, which over time will dry, separate, and disappear, leaving a red mark that heals without scarring. Worst possible outcome. If left untreated, complications may occur. However, this is rare. Serious complications of the infection can begin with the spread of the infection to other areas of the body. It can cause cellulitis, lymphangitis, or septicemia, with worst possible outcomes potentially being scarlet fever, glutate psoriasis, or post-streptococcal glomerulonephritis being the worst.
Treatment for impetigo is largely focused on relief of discomfort, improving cosmesis, and stopping the spread of the condition. The best possible and most common outcome of impetigo without clinical treatment is a complete resolution within 2 weeks. Non-clinical treatments that could improve the condition include tea tree, coconut, olive, or garlic oils. However, these only have anecdotal evidence in support as non-direct treatments, and as a result should not be recommended or dismissed as a form of treatment. Furthermore, it is recommended to take time off school or work as to reduce the spread of the disease that is highly contagious. Having improved hygiene for the duration of the infection and following, it's also recommended to reduce further spread and recurrence of the infection. The most expensive evidence-based approach. Oral antibiotics are considered a more expensive treatment. Flucoxetine is an example of a penicillinase-resistant penicillin, which are often chosen to treat impetigo. Specific oral antibiotics, including clarithromycin, roxithromycin, and azithromycin, are at the higher end of the price range. This is because the dosage levels for these antibiotics are more comfortable for those suffering, and these medications have a reduced risk of negative side effects. Newer generational antibiotics, including cephalosporins and loracarbef, are also forms of more expensive treatment. The least expensive treatment option for our evidence-based approach. A more cost-effective treatment option for impetigo is the use of prescribed topical antibiotics such as mupirocin and fusidic acid, which may be purchased in the form of creams from most pharmacies. These medicines, alongside retapamulin, are more effective antibiotics and are to be applied directly to the sore of the affected individual. Thank you for watching.